Kevin. Welcome to Nithai Partners.
Glad to be back.
Okay. So, Kevin, just a few questions, and I see that Kevin is the CEO and founder of Revenue Partners Inc., and they specialize in medical billing for individual practices, especially for physicians, practices that have less than 5 physicians. And I am Nithai. I'm from Nithai Partners Inc., and now the CEO of Mobi-Comm Inc. And we are also we are a software development company. We offer software as a service platform like a CRM for healthcare industry, focused on healthcare physicians. Same market as him and I, and both of us are now partnering together to offer a comprehensive solution to independent physicians and specialties in San Diego region to begin with. So, Mr. Kevin Stevenson, I'm going to ask him a few questions. So, how long have you been providing these services, or in this industry, medical billing industry? How long have you been doing that?
Okay, in medical billing specifically for about a year, but a little bit of background about myself. I actually got into this business. I'm a corporate financial analyst by trade.
Okay.
So for the last 25 years, it's been my focus to actually help large organizations understand how to manage cash flows and to grow their organizations. So what I've done is I've stepped away from that, and I incorporated my company, Revenue Partners. So that gives me an opportunity to kind of allow the smaller businesses, these small practices, to benefit from someone who has broad experience in the area of finance and helping them to understand these types of things. So it helps them to immediately have access to someone that they ordinarily would not for budgetary reasons. As you might imagine, a small practice doesn't have access to a $100,000 financial analyst on their staff.
Mm-hmm. Oh, wonderful. So it's a very unique need that you're fulfilling for them.
Exactly. So we go beyond just processing claims. We're full practice management. And again, with my background, my interest is not just in processing claims, but helping those physicians to understand, how their practices are performing, so that they can ultimately become more profitable.
Oh, thank you. So this is what Kevin brings to the table, and
And I understand my friend here, Nadi, he has, over 20 years of industry experience, so that's where we kind of complement each other there, I believe.
Yeah.
So if you could tell us about how you got into software development.
So thank you, Kevin, for asking me. So I started my career from Siebel Inc., and I was a CRM person, and I have been in selling CRM solutions, and over a period of time I got into product management, product development, so I have ideas and I have teams who build my solutions. And so I saw a big need for an EMR infused with CRM concepts, especially for independent physicians. So I built an EMR with CRM fusion into it. So it's like it's called NIMDX. It's nymdx.com. It's New York Medical Digital Experience. So it is a very unique system. I can't divulge too much because my competitors will steal my idea.
Okay, got that.
So yes.
So specific. Okay, without talking about these solutions so much, what problem are you helping the physicians to resolve?
So for the physicians, and excellent question, because the biggest problem for physicians is, especially, they don't have the sales background. So they do not know how to build their practice and sales, and they spend too much money on marketing. And even if they market enough, and healthcare is something like you are promoting. So what you are actually promoting is there should be more people sick, and it's a very unethical way to promote your services.
Right.
But traditionally in the villages, how it worked was that if you found a good doctor, then you say, "Hey, I found a good doctor. Go and see him." And then the family will go to the doctor. That was a traditional way of doing things. So I have put that same concept on the system.
Interesting.
And so now when people get onto NIMDX, their practice goes by 1,000% in a year.
Wow.
So we have seen that happening. It's
Yeah.
not, I'm not just saying in the air, it's seen that happening. And with the integration with the Apex EDI billing, now it's a combined, and with you coming on our board and together we're doing something, it's managed billing now. Earlier we were doing billing off of Apex EDI, like a self-service thing, but now you are there. So I can now integrate a pharmacist, a lab, imaging center, billing, and the doctor and managing the patients.
Oh, wow. So perfect complement. So you can increase revenues, and then I can show you how to manage it.
Yes. So welcome to Mobi-Comm and Revenue Partners Inc. And I really thank you for watching this video. Have a nice day and look forward to seeing you tomorrow.
Thank you.